people are just getting the runaround with, they go to their primary, then they go to maybe see a chiro, or maybe they go to see an acupuncturist, they see a massage therapist, and then they finally come to see us. I guess maybe paint us a picture of like what the current model looks like for patients that usually go through, like if my ankle hurts.
I still think to a large degree, most people in America, if they have an ankle complaint, for example, that they would probably go to their primary care doctor first. And depending on what their primary care physician or PA or NP says, or what their viewpoints are, or what their experiences have been, that they might try to manage it with anti-inflammatories, avoidance of activity initially. And for some new musculoskeletal complaints, that actually is very indicated, that self-management strategy is. But so they'll try that first. And then if they come back with the same complaint within a number of weeks, then they might refer them to physical therapy, or they might refer them to orthopedics. It really just depends on the experience and the education and training of that person making the referral. So I think that's typically what it comes down to. And I also have come across primary care providers that are somewhat reluctant to refer to anyone because of their experiences of patients being sucked into a rabbit hole. And that includes physical therapy.
Right.
So sometimes patients, will get, stuck in the wrong physical therapy clinic where, they want them to be, they really just kind of want to maximize their number of visits that their insurance allows. So then they see patients going to physical therapy and staying for like 16 visits when they might not need to. And then other people might refer to physical therapists that practice guideline concordant care and manage things in a more concordant way. And then maybe those primary care providers might be more likely to refer to PT or ortho or whatever, whatever the case may be.
Right.
So I think it really, really, really just depends on what the unique perspective and experiences of each individual primary care provider has been. But I think largely people with musculoskeletal complaints will go and see their primary care manager first. And if it's spine pain, I've also seen majority of general public recommend chiropractic care above anything else as an initial point of contact. That has been my experience just from family and friends that are not in the healthcare industry.
Yeah. And that's not to bash, of course, chiropractors. It's more of just, understanding that there's going to be good and bad providers out there. And I think that's the point of this, is also to, shop around and making sure that you're seeing somebody, whether it's your primary care doctor, your physical therapist, your chiropractor, you're talking to somebody who's trying to get you back to what you're doing rather than just seeing you as another visit, and somebody who's seeing you as just a money bag, so to speak, right? Like they want you consistently in, so that way we're boosting numbers, boosting revenue, and so on and so forth.
And I think that one way for consumers, and meaning patients, the general public, to know if and when you are seeing somebody who is following guidelines and is really invested in you as opposed to their bank account, is if you see a provider and they're going to work with you over a period of time as your condition evolves and hopefully improves and progresses, and then they start spacing out treatment and seeing you a little bit less frequently over time, versus the individual who's like, all right, let's get you on the schedule 3 times a week for 4 months. You got to come or else you're going to expire or whatever. I think that that's one way to know, okay, I'm definitely seeing somebody who's invested in me versus somebody who's just kind of doing a cookie cutter approach for every patient that comes in the door.
Yeah. Same thing with just like even your money, you don't want to go to like the bank or just like someone who's going to manage your money and be like, yeah, we're just going to passively just kind of put it in some stocks, see what happens. You're going to be like, no, I want you to like actually like do some research and allocate my money in places that are going to be important, that could be successful, not just like throw darts at a dartboard.